This is a study that my group did. We looked at 67 throwers done over a 4-year time frame. You can see the breakdown of college, pro, and high school athletes. Most of these were pitchers. But as everybody has already alluded to, 70% of these patients at the time of arthroscopy had associated pathology, primarily partial thickness cuff pathology. They all underwent arthroscopic slap repair. 83% returned to some level of play at the first year, but by final follow-up, only 69% were at the same or higher level, 12% were at lower level. And as Dr. Verma alluded to, the key factor for failure was loss of external rotation in those patients. This was a retrospective review done in 2014, looking at 68 players with documented slap tears. This was in a single professional baseball organization. And this was the study that really started to turn the tide as to how we look at these things. This was from Dave Lintner and the group down in Houston. And they looked at their experience with the Astros. And these were athletes that were diagnosed with slap tears. They looked at a non-operative algorithm looking at correcting their scapular dyskinesia and their GERD and their total arc of motion loss and all the other things that we do from a rehab perspective, and then trying to return them to throwing. And what they found was that the only players they took to surgery were those that failed what they called 2 full cycles of non-operative treatment. And they looked at not only return to play, but looked at return to prior performance. So they started to look at not only are these athletes coming back, but if they're coming back, are they performing at the same level based on a more stringent standard of return to play? And what they found was they were doing pretty lousy. In fact, you can see among their 27 pitchers who underwent surgical treatment, 48% returned to some level of play, but